So this is a loading technique to the back part of the shoulder. So that roughly covers right on top of the shoulder to roughly back here. So this area. You're going to need a ball. You're going to place it on the floor. So there's two methods you can try. The first method is the seek and destroy. So what I'm going to do is I'm going to place a ball back around the target tissue. I'm scanning that area. So I'm going down towards my elbow and up towards the shoulder. Wherever I feel more sensitive, I can hold that there. I can pivot my arm in or out wherever I feel more load, which is roughly when I go in right here. I'm going to hold that position. I'm going to take a breath in and exhale and try to apply more weight and melt into the ball. Once it desensitizes and destroys that area, then I can progress to another spot. Exact same thing. I'm going to go up towards my shoulder, down towards my elbow until I feel a sensitive spot, turn in and out. Wherever I feel more, I'm going to hold that position, take a breath in, exhale, and just try to melt into the ball until it desensitizes. The second method you can use is more of the pin and stretch. So you're going to do the exact same thing. You're going to scan the area. I'm going to go up towards my shoulder, down towards my elbow. Wherever I feel more sensitive, I'm going to hold it. I'm going to pivot in or out until I feel more. I feel it more when I pivot inward, so I'm going to hold that position. And then from there, what I'm going to do is I'm going to take this opposite hand, and I'm just going to side bend my head a little bit and hold that position. Again, I'm going to take my opposite hand, place it right on my head, relax my head, and then just pull my head up. I can turn my head and bring it through different directions. Wherever I feel more stretch or more load, I'm going to hold that there. Now, mind you, if it bothers your neck, this might not be a good one for you. Another technique that I can do with the pin and stretch is I can find that area that's sensitive. After I pivot in and out, I can hold it there, and then I can rotate my body forward or back wherever I feel more. You're most likely to feel it when you tilt your body forward, so I'm going to demonstrate. I'm going to move my body forward and stretch that area out while my arm still stays in the same place. You're going to want to have a tendency to move your whole body and your shoulder, but you just want to keep your shoulder there and then pivot your body over your shoulder and hold that position. So again, what I'm going to do is I'm going to find an area that's sensitive. I'm going to go up my shoulder, down towards my elbow, keep my elbow bent at 90, pivot out or in wherever I feel more sensitivity, hold that position, and then what I'm going to do with my body is I'm going to lean over my shoulder until it stretches out a little bit. So I'm going to place this hand a little bit higher so you can see the ball. You're most likely going to place your hand right here and then rotate into it.